Hi, I'm Amy Shroff. I'm a small animal veterinarian in Boston, Massachusetts, in the United States. I'm also president and founder of Let's Save the Strays International, and today we're going to talk about our TNVR project in Myanmar. I would like to take this opportunity to thank our co-presenters, Dr. Joanne Lindenmayer and Gary Evans, for their super collaboration and expertise, and also for them being excellent board members. I'm going to take myself off the screen so you can see the slides more clearly. Many people have asked me why Myanmar, and I believe that Myanmar fits with our mission. And our mission at Let's Save the Strays is to go where no one else will, to treat the animals and communities that the world often doesn't see. I came to Myanmar at the request of several animal advocates that were interested in alternatives to poisoning after volunteering in Thailand for several years. At the time when I arrived, back in 2016, there were no international organizations that were working in Myanmar. And the main reason for that was the lack of an MOU signed between the government and these organizations to stop poisoning en masse. And poisoning is the main way that the country deals with its overpopulation of stray dogs. I wanted to show that TNVR could be a viable alternative despite these hurdles. My other goal was also to educate on improving the humane care for these stray dogs because it was sorely lacking at the time. The fallout from COVID, the current civil war, and the latest earthquake that hit Mandalay in March of 2025 has left the country in worse shape than it was when I first visited. And so all of these factors combined have made proper data procurement very, very difficult. Currently in Myanmar, there is censorship, resulting in restricted access and even periodic shutdowns to the internet. The community does rely on each other for information, and the way they share it mainly is through social media and Facebook. It's still the lifeline for them to the outside world. And I wanted to point out by sharing this slide that the Burmese Let's Save the Strays Myanmar Facebook page has 10,000 followers and 7,000 likes, compared to the U.S. Facebook page, which has 1,300 followers. That tells me that there is a growing widespread interest in our project and an interest in TNVR in general. The team has created this site and posts on the page on a regular basis, all on their own, creating educational materials and project updates. They also communicate with people who send messages to them on a regular basis. And while Facebook is a wonderful form of communicating and connecting with the community, we still rely on paper for documentation. And I just wanted to point out this registration form that everyone has to fill out before we can consider any request and site visit for TNVR. Our dedicated phone line is also essential to communicate for emergency situations, especially with the community animal guardians, and it's manned by our program managers 7 days a week. I want to mention a few key points about site selection. When choosing a new site, we try to get as close to the previous one as possible, rather than random selection in other parts of the city. So you can see on this partial map of Yangon that we try to work in 1 to 2 townships adjacent to each other. There are natural barriers to getting closer, such as traffic, easy access for various reasons. And the reason we want to be close to the previous project is that our overall goal when doing TNVR is to do TNVR on as close to 75% of the given population as possible. And in this way, we can see over time that the improvement in the body condition and behavior of these animals, there's less crowding, will hopefully make them be happier, healthier, more accepted community members. The caretakers of these animals, or community animal guardians that we are now calling them, are at the selected site. They are the people that reach out to us for request, and they are the key people that understand the number of animals that are there on an approximate basis. As for our TNVR process, we do have a few rules that we like to follow when setting up these projects. We do request that no dogs be previously sedated or darted with sedatives before coming to the project. We want to make sure that every animal is awake so we can assess them for surgery. It's also very important that we don't have people bring animals from very far away outside the area, as we want to focus on the area that we've decided to work in and the population of animals that live there. Catching dogs, as many of you have probably experienced, is the most challenging part. We use large custom-made nets that we get made in the city. We have dog catchers that have been very successful at catching many of the difficult to handle dogs. We do not catch all of them, and that we understand that is part of the process. Because of this, we do rely heavily on the community animal guardians to help catch them, because they're the ones that feed them and take care of them on a regular basis. So they put them in cages that we provide to have them wait for surgery to be done on the day of. They also are the people that will be taking them back to the exact location that they came from. They are the ones that are going to be receiving written information on post-operative care, and they are going to be the key touch people for letting us know if there are any problems or concerns with these animals. Every dog is registered with the person who brought the dog to the project, their information, the exact location, the signalment of the animal. And we also insist on strict sterility. For us, that means that each animal gets its own dedicated autoclave sterile surgical pack, suture, drape, gloves. We don't have any sharing of any supplies or equipment. And right now, we're doing TNVR on approximately 350 dogs a month in both Yangon and Mandalay. This slide here shows just a few of the 20-plus volunteers that work with us nearly every month in Yangon. The Burmese community ownership of this project is truly the cornerstone of why it's been able to move forward as well as it has. The other aspect of why this model works, in our opinion, is the standardization of the process. Every site, every city, every aspect of the project is the same from beginning to end. And I think the fact that it's the same each time allows new team members to be trained easily. It also manages expectations and helps the project to flow much more smoothly. In terms of building our workforce by tapping into the veterinary student community, I want to mention that the training that we received for the Burmese team by Soy Dog and Worldwide Veterinary Services, both of which are in Thailand, is available to other organizations. I highly encourage other groups to contact them. Their information is on their websites, and they have been absolutely instrumental in getting our team trained. It was the team's idea to foster relations with the veterinary students. There is only one veterinary school in Naypyidaw, the capital, and that school does not teach hands-on surgical training. So we reached out to them to offer mentorship. The students started as basic assistants and ended up, after graduation, becoming new surgeons with a lot of hands-on training for the months to follow before going solo. Our plan also in 2026 is to start a surgical training program focusing on TNVR at the veterinary school, hopefully after the earthquake repairs are complete. Up until now, we have relied on our own anecdotal observations to assess the condition of the animals in the areas we've worked in. So the health and physical status of the dog, nursing females if present, puppies if present, any diseases such as transmissible venereal tumors or mange being present. We've relied on our visual assessment. We need to move towards using a more data-driven and objective method of measuring our impact. The Mission Rabies Tracking app is what we're planning on using in the coming months. And we are very, very grateful to Mission Rabies for allowing us to have access to it. It's a very customizable, easy-to-use app. It allows us to formulate our own parameters for the team to use when checking out the animals. And it uses the phone's GPS system to track where the team is going to be headed, whether on foot or bike. So once we designate a particular area that we want them to work in, we can do a pre and post TNVR census. While we always have educational materials at our TNVR days, we have banners and we have written education material that we hand out, we want to also launch an accompanying education plan. It's really vital that we continue to educate the public, mainly children, on the benefits and the necessity of TNVR and vaccination. This slide shows what we did in Mandalay as kind of a pilot project when I was there in February at a very poor government school. And at the request of the teaching staff that knew about us, we did a small TNVR project on about 30 or 40 dogs, and we spoke with the kids on animal safety, rabies, and TNVR. I'm super happy to report that the school and the animals that we treated are safe in the recent earthquake that happened in March. As far as working with local businesses, we have been able to establish some connections with a large pet store chain and an animal-friendly cafe company in Yangon, and we're really hoping that this will continue as our project grows. Establishing ourselves as a Myanmar NGO is essential to have government recognition, and unfortunately this process is very, very slow given the current political climate that we're in right now. So what have we learned by working in Myanmar all these years doing TNVR? Well, our goal is not just to do TNVR, but to influence for the better the way Myanmar sees its street dogs and how to live with them in harmony. In order to change the current mentality, the locally managed and led team is key. These people are the stakeholders, and they are the essential movers and shakers of this project. This is also a One Health mission. And if people and animals are to benefit, all the letters need to be done together and at the same time. The T, the N, the V, and the R. Done separately, they're just not as effective. I'm a firm believer in consistency and persistence. For anyone willing and interested in starting a project like this, my advice is to not necessarily focus on the number of animals that you're treating each time. Focus initially on planning, making sure that you know why, how, and where you want to start a project like this. Try to do it on a monthly or every other month basis. Start slow. Get your team used to handling all of the instruments and processes that you want to implement. It's also super important to network with everyone, engage the local community. These are the people that work with these animals, that live with these animals. Engage with them because they will be the ones that have a vested interest in the project. I also insist on documenting every aspect of the process. Make sure that you document and list all of your supplies, your locations, the numbers of animals, the team that you work with. I live by the adage that you cannot expect what you do not inspect. Finally, I would like to express my deep thanks to our amazing Burmese team, the doctors, the students, the community animal guardians, and volunteers, and of course all of the organizations who have been so supportive to us, especially during the earthquake crisis. Thank you so, so much. And to ICAM, thank you again for this amazing opportunity to have us share our experiences.